Hello everyone. Today we'll learn about sample collection and handling. So what is specimen? Specimen may be defined as small quantity of substance which shows the kind and quality of the whole. So why do we collect specimen? To assess the general health, to investigate the nature of disease and to make diagnosis and to help in treatment. So the quality laboratory result begin with correct and complete sample collection. So the broad objective of this is to be able to correctly collect the specimen and put the specimen in the right container and transport specimen to the laboratory correctly and at the right time. So what are the aim of sample collection? So actually the accuracy must be maintained. So accuracy is nothing but to ensure that analytical results obtained are representative of actual analyte in patient and thus of his or her physiological or pathological state. So the safety measure should be followed. Before collecting specimen, he or she should be safe and they have to follow some rules like using barrier protections. So minimize patient discomfort and complications and avoid recollection. So what are all the example of biological specimen? That includes blood, urine, feces, saliva, solid tissue, amniotic fluid, cerebrospinal fluid, synovial fluid, peritoneal fluid, pleural fluid, or pericardial fluid. Whatever the sample we collect from the patient, we call it as specimen. So blood sample collection. So when a large amount of blood sample needed, an evacuated tube system with interchangeable glass tubes can be used to avoid multiple vein puncture. So evacuated tubes are commercially prepared with or without additives. Types of blood collection. The blood can be collected from capillary, venous or arterial. So capillary blood, it is most frequently obtained from finger or thumb. Capillary blood is similar in composition to arterial blood. So venous blood. Venous blood, it is most often collected. A vein on the front of elbow or forearm is universally preferred to collect venous blood. Arterial blood, it is most obtained by inserting a needle into the radial, brachial, or femoral artery. Arterial blood is less frequently examined. It can be taken for blood gas determination, nothing but ABG. Types of blood to be used. So we can use whole blood, plasma, or serum based on the test, whatever we're gonna perform. So whole blood can be used for ammonia, HB, lactate, and pH measurement. Plasma is nothing but obtained after mixing the blood with anticoagulants, precipitating and separating the RBC and WBC cell. So after the addition of anticoagulant, the erythrocyte cells will be sedimented down and the plasma can be separated, and from that we can do a further test. So the plasma is used for the estimation of ascorbic acid, bicarbonate, glucose, chloride, and fibrinogen. Serum, the liquid portion which is left over after blood is allowed to coagulate without adding anticoagulant, is called as serum. So the serum lacks in coagulation factors like prothrombin and fibrinogen. So serum is used for estimation of many parameters like total cholesterol, albumin, bilirubin, and so on. All the biochemistry tests can be performed using this serum. So what is the difference between plasma and serum? Plasma is the liquid which is cell-free part of blood that has been treated with anticoagulant. Serum is the liquid part of blood. After coagulation, there will not be any anticoagulant will be added. So plasma centrifugation done directly with anticoagulant, and then plasma clotting factors will be present, like example prothrombin or fibrinogen, and the plasma can be given to patient lagging with blood cell. So in serum, centrifugation is done after coagulation without adding any anticoagulant, and there will be absent of a coagulation factor, and it is used only for diagnosis purpose. So both the plasma and serum can be used to measure diet components, vitamins, synthetic chemical exposures, and so on. So serum is better for antibody measurements, nutrients, etc. So in the serum, blood clot will be happened, and in the plasma, WBC and platelet cell will get sedimented or separated, and the liquid part will be used for the diagnosis purpose. So what is anticoagulants? So if plasma or whole blood is required, blood must be collected into a vial containing anticoagulant. It prevents the coagulation of blood. So coagulation is nothing but inactive prothrombin will get converted to active thrombin, which in turn forms a fibrin, which is nothing but a clot, and this process will be stopped by the anticoagulant. So nothing but the anticoagulant is going to stop the process of coagulation. So different types of anticoagulants will be used based on the diagnosis we're going to do, based on the parameter we're going to diagnose. So here we have a heparin. Heparin is anticoagulant. It is a most satisfactory anticoagulant which inhibits the formation of thrombin from prothrombin. So it does not produce a change in red cell volume or interfere with subsequent determination. EDTA, ethylene diamine tetraacetic acid. So EDTA has chelating action on calcium ion and prevents coagulation. So it is well suited to all hematological studies. So it is widely used anticoagulant for a complete blood count. All the hematological test or complete blood count can be done using this EDTA. So potassium oxalate. So it acts by precipitating calcium ion. Potassium oxalate has been the most used oxalate since it is most soluble. Sodium citrate. This does not precipitate the calcium but converts it into a non-ionized form. Sodium citrate is a satisfactory in estimation of prothrombin estimation, and sodium fluoride, usually used as a preservative in blood glucose estimation. It inhibits red cell metabolism as well as antibacterial action. Blood collection using this vacutainers, actually this each vacutainer have a different color caps, so this different color cap indicates a different additives, so the each color code indicates a separate specific additives. So purple color cap indicates the additive EDTA, where you can perform CBC, complete blood count, blood typing, cross match, HP, red blood cells, or ESR. So blue color indicates trisodium citrate with the ratio 9:1. So using this blue color vacutainer, you can perform PT, APTT, fibrinogen thrombin time, and other blood coagulations test. So green color encodes heparin. In that we can able to perform ABG analysis and TNF and lymphocyte immunotherapy, etc. So golden color indicates the polymer gel and powdered glass clot activator. Here we can perform all biomedical parameters, liver function test, kidney function test, lipid profile, another biochemistry assay, serological test also. And red color cap indicates powdered glass clot activators. In this, we can perform lipid profile, serology, therapeutic drug monitoring, blood bank procedures, and so on. So, gray color cap indicates sodium fluoride, where we can perform PPBS, postprandial blood sugar, and toxicological test, etc. So, black color is again it is a trisodium citrate, but with a ratio of 4:1. In this, we can able to perform ESR. Changes in blood on keeping, if we keep a blood for a long period of time, what are all the changes happen in the blood is, first thing is loss of carbon dioxide, and the conversion of glucose to lactose happens, and increase in plasma inorganic phosphate level due to formation of hester phosphate present in the cells, and formation of ammonia from nitrogenous substance, and conversion of pyruvate into lactate. Thank you.